everyone, I'm Erica, the Community Marketing Associate for Springer Publishing Company. Thank you for joining us today for this Nurses Week workshop, which will help you create your very own professional roadmap. The workshop will be presented by Rhoda Redulla, who is the Magnet Program Director at York-Presbyterian Weill Cornell Medical Center, a Magnet designated top 4 hospital in the nation. She is also the editor of Fast Facts for Making the Most of Your Career in Nursing, a how-to resource built to help nurses advance in all stages of their professional journey. This workshop will be recorded and you'll be able to view it again in a couple of days at springerpub.com/videos. Please feel free to ask questions in the Q&A section, and now I turn it over to Dr. Redulla.
Thank you so much, Erica. Good morning, everyone. Thank you for being here and happy Nurses Week. And thank you to Springer Publishing for hosting this webinar series, Be Nurse Strong. Strong nurses have strong career plans. And I'll start with a personal story. This picture right here that you see on the bottom brings me a lot of joy and takes me back to my life when I was a young nurse and I was asked to, or our class was asked to work on a nursing history paper. You're asked to go back to our hometowns and research about how nursing started. So with that to heart, I went to the first nursing schools, tried to speak with the first nursing deans, early nursing students, and I did not leave any stone unturned. And I actually had the great opportunity to meet one of the oldest living nurses at that time. When I finished the work, I had this unstoppable feeling to share it. I already got it published at that time in our local publication in town, but I wanted to share it to a bigger audience. So my young, motivated self, here I was. I went to the internet. This was in the early 2000s, many years ago. And I found the Society of Philippine Health History. I wrote an email to the contact info that was put on the website. I went to bed and I woke up the next morning. Guess what? I got a response. That was from Dr. Willie Ong right here, standing in this picture. Dr. Willie Ong is the leader of the Society of Philippine Health History, and gave me a very positive response. He said that I had a beautifully written piece of nursing and health history and wanted to publish excerpts of that immediately on the website. But it's pretty long, so he also offered to see if I would be interested for the work to be featured as a column in the Slice of History column that he had with the society. It's a national column. And I said, of course, right? Absolutely. So I said yes. And that was one of the early beginnings of my experience in publishing. It did not stop there though. After that work, he reached out back to me, Dr. Ong, and his wife is also a physician. They said that they are working on the next edition of this book. So at that time, it was just Medicine Blue Book, and it has been their vision to come up with a joint reference for nurses and physicians, the pocket guide that you can just use at the bedside. And they said they're really looking for a nurse to collaborate with, and if I would be interested. And I said, if you teach me how to do it, if you just show me how you want it done, I will do my absolute best to do it. And that was history. It has now reached its 7th edition, and I continue to collaborate with them. But this picture that you see right here was a visit that I had my daughter, who was, now she's now grown, but it's this is like 7 or 8 years from the time my family moved to the United States, and Dr. Ong met us in the Philippines. So I'm sharing that with you, and you see this word right here, this phrase, positive audacity. Sometimes I think that I coined that word because audacious, if not done right, is not good, but should be in a positive way, being brave and bold And that takes me to this next slide, building your strong career plan. You're probably thinking right now or wanted to ask me, so Rhoda, as a young nurse, you were already thinking of that? Creating a professional roadmap, building a strong career plan? Probably not, right? But I knew that I was guided by my vision. And what was my vision? My vision was to be the best nurse that I could be, being the best professional I could be, so I can give the best possible care for our patients and their families. That was my vision. And to this day, that guides me as I create my professional roadmap, which I am so excited to share with all of you today. This quote I wanted to share with you. Dr. Stephen Covey, in his book, The 7 Habits of Highly Effective People. People are working harder than ever, but because they lack clarity and vision, they aren't getting very far. They, in essence, are pushing a rope with all of their might. Let's go to step 1. As promised, this will be a step-by-step guide in creating your professional roadmap. First, self-assessment. You probably have seen this acronym in your strategic planning sessions at work, in your hospital, at your hospital, in the university, whatever setting you've been. But today, we are thinking about this and framing this from a personal perspective. SWOT analysis, S for strengths, W for weaknesses, O for opportunities, and T for threats. Let's take this and break it down, and starting with S. Martin had these great questions aligned with looking into your personal strengths. What are you naturally good at? You see this illustration right here on the left? Wow, I said, we actually have a lot of talents, you and me. You can look at this image right here and you can identify at least one of them where you probably are good at. Nursing students or nurses, in the audience, you'll see, oh, I know that I'm a diplomat probably because I'm good with making connections and building relationships, or you could be a motivator or a cheerleader for your team. What are you naturally good at? Do you love data? Do you love speaking? Do you love, are you the go-to person for those hard sticks, for IV insertions at work? There is that something. And what are your talents? So look into that. And I want you, if you have a paper right now, write those down under S. What are my strengths, right? What skills have you worked to develop? If you look at the past year or even the past several years, were there trainings that you kept going back and wanted to really, be a master of, like you kept going back to, let's say, a research conference, you kept going back, research conference this year, another research conference this year, or you wanted to learn more about informatics. So you just, kept going back, or documentation, or legal, the legal side of healthcare and nursing. What that means that if you have done most of them or a lot of them, those are the skills that you probably have worked to develop. Write them down. Okay, so here's what I was talking about. Could be cardiac rhythms, even data analysis. Maybe you love statistics and data, and peripheral IV insertions. So that's a nice prompt and guide for all of you. And also, Bill George asked us this as we are looking into our strengths and doing our SWOT analysis, just something that you are trying to keep at the back of your mind. What do you love most about your current job? And what do you wish you could do more of? What do you think you were put on this earth to do? And what were you put here to teach? And that was from Bill George. How about your weaknesses? Oh, it's probably a hard slide to look at. What are your negative habits and traits? What are your skills that need improving? Look at this right here. Do you find yourself being quiet during meetings and catch yourself later like, oh, I should have at least spoken once? Do you have trouble? You're a leader in the audience. Do you have trouble having difficult conversations, or even not as a leader in regular everyday conversation? Is it hard for you to engage in those challenging conversations with patients, families, families in the hospital, or peers, or electronic documentation? Do you find yourself going back to peers asking for help over and over again? Or time management? What are those challenges? Put them on your weaknesses page. Okay, so the next one is opportunities. These are the questions that we are asking ourselves. Is there new technology in your industry, new gadget you're working with in the hospital or within your field? What new regulations have evolved that have impact on your current field? So look at them and, again, write them down. This may just be some of the opportunities that you see right here. Robotics, right? Whether you're in the surgical, the surgical department, or other aspects where robotics now is implemented, or even AI technology, machine learning. How about telehealth? A year ago, or over a year ago now, we probably have not imagined ourselves being this more of part of our routine practice than the exception. So things have changed, and these are all opportunities that you can reflect on, including palliative care, which is changing, from day to day, just because of the changing healthcare environment. T for threats, another hard slide probably to look at, but it is important to include this in the exercise, doing your self-assessment. What are the biggest external danger to your goals? What are the strong areas of competition for jobs that you are best suited? Think about this. I put this illustration here, the graphic of a time bomb. What are these things that you're not thinking about that are actually ticking like a bomb sometimes, that you really absolutely think about them? Who among you remembers Blockbuster? Well, some of you probably don't, but in my era, remember when you were so excited on a Friday night and you would go to Blockbuster waiting for the release of the next film or your favorite next, like cartoon movie or whatever you have on your wish list. So who would have known that was going away? We were just so happy with our DVDs and Blu-rays, and now you can do it in a click of a finger or a push of a button through live streaming, right? Looking at the threats, and pagers too. Who would have known that we are now in our digital age in a different way, where we can message and have secure mobile text messaging in our hospitals and in our workplace at a totally different level. How about being in Zoom land or Microsoft Team land? Like right now, we are in this webinar, and it's amazing how we are able to connect with the rest of the country and the rest of the world, but things probably that we have not imagined before. So you get the point, right? SWOT, that's SWOT. So now step two. Step two is peer feedback. Some organizations have integrated peer feedback into the annual performance review process. And the American Nurses Association has principles of peer feedback that they have published, and magnet organizations have adopted these peer feedback principles and integrated them into their practice and into their organization's processes. It is important to go through this exercise. And personally, I do this as well. Another part of step 2 is manager feedback. Remember, when you go for your performance evaluation, that's a critical step of it. Doing your self-assessment and actually integrating your manager feedback. These are all critical elements in the process. Now, it's time to create your strong career plan. I have a poll to ask you. So I will ask this question. When was the last time you reviewed your CV? And if you can just respond to in the last 6 months, in the last 2 years, 5 years, or Rhoda, I don't have a CV yet. So just put that in and vote. And I'll give you 2 more seconds, maybe. Wow, this makes me so happy. In the last 6 months, 73% of you in the audience. Some have not. In the last 5 years, like 1 and then 2 years. That's amazing. Congratulations to all of you. And you will learn that that's best practice to look at your CV at least once every 6 months to a year. And I'll tell you why in a little bit. So the next step in creating a strong career plan is to look at your CV and do, see the word right here, a gap analysis. How do you identify the gaps? So your homework today, go look at your CV and look at every category. Your progressive professional experience, your education, your certification, training, presentations, community outreach, publications, service to professional organizations. And probably a quick gap that you will identify is you'll not see some of the categories here. And it's fine. It's totally fine. The important thing is you are recognizing that and you know exactly how this aligns with your big goal. Okay? So go back and look at your CV. Now, you looked at each line and you probably will see that, wow, I have attended a ton of programs and conferences and training programs in the last 2, 3, 4 years. But I've not really been involved in any community outreach project at all. Or I think I need to start thinking about being certified because that's a critical step of being recognized as an expert, not only by your patients, families, and peers, and being, it really brings a great feeling of being a professional, but also, of course, certification. The bottom line is that it is linked to better patient outcomes, better patient care. So what is that? What have you identified? And next step, develop SMART goals. Okay, said Rhoda, again, we know about SMART goals. Today, I want you to put your SMART goals, knowledge, and know-how into developing your personal goals. What does S mean? It needs to be very specific. Okay, M, measurable, attainable for A, R, relevant, and that goal is not complete without T, time bound. Remember, you have to make it happen and you need to know and hold yourself accountable as to when. So I will just share this with you. How do I start? Where do I begin? You will probably can look at where you are in terms of your advanced degree or continuing education. A critical piece of that, though, is once you're done and you have done with that, make sure that you go out and apply that and be involved in a project. The next step is dissemination, either through presentation and publication. And in that way, you are developing yourself as an expert. You are becoming the best nurse that you can be. Now, let's go back to the SMART goal. Here's an example. In the next 6 to 12 months, I will participate in a quality improvement initiative in my department. Is it simple? Is it measurable? Yes, you said one, right? In one quality improvement initiative. Is it attainable? Absolutely. Is it time bound? Absolutely. Next 6 to 12 months. So that's an example. So how do you then create that plan to achieve this goal? So first, you'll probably want to join your quality and patient safety committee. I probably would have put this gray box here in front saying the first goal, the first step is to communicate your goal. It is great and important to communicate your goal not only to your manager, but to your peers and to your immediate work circle, so they know what your goals are and they know how to support you in your goal. Then they can connect you with the appropriate network, like the contacts for the quality and patient safety committee and so forth. Now, you can move forward with working into what you are passionate about. Are you passionate about false prevention? Are you passionate about reduction in med errors? So things that we don't want to happen to any of our patients, nor any of amongst ourselves or our family members when they're in the hospital. So what is that? And again, we don't have to solve and dream about solving world hunger. Start small and make an impact right there. Was an identified weakness, fear of public speaking, or improving confidence in speaking, and transform this to here to the right. That could be your other goal, or that could be another goal. In the next 6 to 12 months, I will improve my confidence and successfully present in at least one hospital-wide meeting. Again, go back to our SMART goal. Is it simple? Is it measurable? Yes, I said like you will participate in one, right? Is it time bound and so forth, right? You get the idea. So now here's how to get there. Communicate your goals, again, to your supervisor, to stakeholders around you, to your peers, to people who can support you to do that. You would probably be supported to go to a virtual public speaking course, or as the pandemic is now getting a little better, so you can probably go to an in-person public speaking course, and then volunteer, right? Volunteer to present in a meeting, and even outside of your hospital or outside your place of work, and actually present in a podium presentation and so forth. All right, so that is, those are the steps in creating your professional roadmap and having a strong career plan. Now, this is the big picture. I want you to think about what is your big dream, because it's okay. It's nice to look at the year to year and day to day things that you want to make sure align to your goals, but what is ultimately your big dream? You may not have that yet as clear as day right now, and it's okay, but make sure that as you are looking through the CV review, the gap analysis, the SWOT, that you are thinking about this, like 5 to 10 years from now, where do I see myself doing? You know, what do I see myself doing? Do you want to be a chief nursing officer? If that is your ultimate goal, you probably are gravitating towards a charge nurse role, a nurse manager role, a nursing supervisor role, or an administrative supervisor or preceptor, right? And aim to go to the next step of being a director of nursing. And you are, the COO of your department or service line, and you are developing, and even at this level, with the nursing manager, nursing supervisor levels, and charge nurse, you are involved in knowing the regulatory guidelines, Joint Commission, the state regulations, human resources, managing people, financial management, and a lot more here, developing a strategic plan for your department, and so on, until you will achieve your big dream of being a CNO or the highest nurse executive in your organization. How about another big dream, or other people's big dream will be a nursing professor? So early in your career, you could be a preceptor, be a charge nurse, and we have a lot of amazing second career nurses. I have taught second career nurses for like almost a decade. I had my students who were amazing elementary school teachers, graphic artists, computer programmers, but nursing was knocking at their door, and eventually became amazing clinical instructors, course directors, and nursing professors. So with that, they made sure that they were honing their skills. You see here in the top left, the know-how on adult learning theory, learning about evaluation, curriculum development, building courses, making PowerPoints like this, like what I have today. Yes, so those are critical steps that I want you to do. Now you see someone who has probably dreamed big as a child or in his younger self. This is Neil Armstrong. So Neil Armstrong, you can fill in the blanks for me, was the first man on the moon, right? And if you go out on the web or Wikipedia and learn about his lifestyle and see adjectives that describe him, you will see courage, determination, adventurousness, and he reminds us that we can do almost anything. And as nurses, I want to remind you today, we can be anything. Especially as we celebrate Nurses Week, I want you to think about this and be inspired about this picture and the next pictures that I will be showing to you. How about Mother Teresa? So if you go and study further and read further in the life of Mother Teresa, she is a leader, authentic leader, known for her compassion. And there's actually literature that describes her as a disruptive innovator, only for the best good, for the common good, to serve the most vulnerable people. And as nurses, we somehow relate to that and connect to that unfathomable compassion and caring that Mother Teresa has. That's what we are somehow born to do, like when we are giving those, like the daily care for our patients. And I would be remiss if I don't share this with you, Florence Nightingale, who is the founder of modern nursing, leading a team of 38 nurses at an overseas hospital during the Crimean War. Like, wow. And she has many quotes, but this is one of my favorites. I attribute my success to this. I never gave nor took any excuse. I will also share with you a beautiful quote from Dr. Patricia Davidson, former dean of Johns Hopkins University School of Nursing. That's where I had my doctoral program, and I'm a proud alumni. And Dr. Davidson is now the vice chancellor at UOW in Australia, just transitioned. And she wrote the foreword in my book, Fast Facts for Making the Most of Your Career in Nursing. And I quote today, I have been a nurse for over 40 years and have never for a moment regretted this career choice and have seized opportunities. I read through her beautiful foreword and I go back reading this over and over again. Now, personal story. We're getting close to the end, and I want to close with a personal story. So my clinical background, I'm a magnet program director now, and I lead our organizations, and I also support other organizations in the magnet recognition program, which is the gold standard of nursing excellence. But my clinical background is gastroenterology and hepatitis C, and I worked a lot with hepatitis C patients. And in my clinical life, I really fell in love with caring for pre-transplant patients and even post-liver transplants who were struggling to clear off the hepatitis C virus. And when I went for my doctoral program, I focused my doctoral project on hepatitis C care. And this is it. For a quick tip when coming up with the project is it's always nice to have acronyms. So I have Project PEACH, Pathway and Education Towards Adherence and Completion in Hepatitis C Management. When I completed my doctoral program, at that time, I was a new member of the Society of Gastroenterology Nurses and Associates. I had the opportunity to present this initially as a poster, and later on, I proposed for a workshop to teach liver and GI nurses across the country at the annual course of the SGNA every year, and it has been offered for several years. That was how this evolved, and this is the publication that came out of it that was published. And I'm just sharing that with you because when I mentioned to you, as you're creating your professional roadmap, you are developing yourself as an expert, you pursue your passion, and you will be able to improve care on a bigger scale, again, for the better care of our patients. And you're probably asking, probably want to ask this question from me, like, how about if there are bumps in the road or challenges in my journey and in that roadmap that I created? Of course, it's not perfect. And this is a quote from Brandon Steiner: "You can't let a bump in the road put you on the side of the road." So we have talked about today, if you create your professional roadmap, first do a SWOT analysis and create your professional your roadmap. And I have come to the end, and I actually have time to answer some questions. And this is my book right here, published by Springer Publishing, Fast Facts for Making the Most of Your Career in Nursing.
Thank you, Rhoda. We actually have one question, which is, which educational or career paths are recommended for the nurse that prefers to work remotely from home?
Great question, Erica. I mentioned earlier telehealth. That's absolutely one opportunity that someone who's interested in working remotely can pursue. There are also a lot of industry-related jobs where nurses are working right now, even in pharmaceutical companies or insurance companies, where they can work totally, from home. And even in nursing informatics, there is a lot of opportunity for those who, like in their current personal and work life, they just need to pursue that path of working remotely.
Great. I don't think there are any other questions. So thank you, Rhoda, and thank you everyone for joining us. We hope you enjoyed the workshop, and you can get 25% off Dr. Redulla's book on our site at springerpub.com/BeNurseStrong. And happy Nurses Week.
Happy Nurses Week. Thank you.